Please tell me, what do you think about your friend's performance? How do you think they performed in today's teaching session? You liked some? Okay, tell me, who do you think should be the winner? Who should get the first prize? Okay, to guess, Fahmida Jahan Trisha is the first prize winner. Congratulations. Everybody please. That side is saying Fahmida, that side is saying Alicia. The second prize goes to Alicia Shocker. Congratulations, and ma'am. So the second prize also gets a certificate as well as a prize. Please, huge round of applause, Alicia Shocker. Anybody wants to guess who is the third winner? Okay. Yes, from that side? Okay. So the third prize goes to Muhammad Manarul Islam. And as we promised, along with the certificates, you will also get a prize. Ma'am, please, this prize is also for the third position. Please, huge round of applause for the third position. Thank you, ma'am. The next student is Fahmida Jahan Trisha. Please welcome her. And her topic is development of heart.
Assalamu alaikum. Good afternoon, everyone. We all are here to attend a great competition named Everybody Can Teach. Thanks to our respected teachers to give me the opportunity as a competitor. Let me introduce myself. I am Fahmida Jahan from second semester, third group. From my little knowledge, I am going to explain today the development of heart. So first, we have to know what is heart. The heart is an organ that pumps blood through our body. Heart has 3 layers and 4 chambers. The 3 layers are epicardium, myocardium and endocardium. Then 4 chambers are left ventricle, left atrium and right ventricle and right atrium. Now we will know about the embryo of heart. Heart will arises from the lateral splanchnic layer of embryo. And the region is called cardiogenic area. This cardiogenic area going to form cardiogenic tube. By the help of lumen, this cardiogenic tube is going to be cardiogenic cords. And those cords fuse together and make primitive heart tube. Next slide please. Primitive heart tube is look like that. I draw it by myself. First one is bulbous chordiosis, second one is primitive ventricle, third one is primitive atrium, and the final one is sinus venosus. Let's talk about the first part, bulbous chordiosis. Bulbous chordiosis is going to be divided into 3 parts. Next. Bulbous chordiosis is going to be divided into truncus arteriosus, conus, and proximal. Between bulbous chordiosis and ventricle, there is a junction called bulboventricular sulcus. Between primitive atrium and primitive ventricle, there will be a canal, and the canal name is atrioventricular canal. And the final is sinus venosus. We can divide sinus venosus into 3 parts: body and left horn and right horn. Left horn and right horn is going to drain 3 sets of veins, and those veins are umbilical vein, common cardiac vein and vitelline vein. By watching the primitive heart tube, this is not the actual shape of heart, but how we will going to be form of the shape? By looping. Truncus arteriosus and bulbous chordiosis is going to move down to the left. Primitive ventricle is going to move down to the right, and primitive atrium is going to move upward and downward. So the final look is like that. we can say that primitive atrium is going to be right atrium, this primitive atrium is going to be left atrium, and bulbous chordiosis is going to be right ventricle. Primitive ventricle is going to be left ventricle. Then we need to know about septum to divide our. Now we will know about the septum. The septum is that divide our atriums and ventricle. First we will know about intra-atricular septum. But we have to know first about septum intermedium. Septum intermedium is developed from the atrioventricular canal. Atrioventricular canal release some atrioventricular cushions from anterior and posterior side. These cushions fuse together and divide right atrioventricular canal and left atrioventricular canal, and this is called septum intermedium. This septum intermedium will rise the intraventricular septum. From the apex of this heart, the septum premium is going to happen. This septum and septum primum's aim is to meet septum intermedium, but for the blood flow, it can meet together. There will be a orifice. There will be an ostium. This ostium will cause ostium primum. Then this ostium primum is not permanent. It will soon disappear, and there will be another ostium for the second time. This is called ostium secundum. Then there will be another septum happened. This is called septum secundum. This septum secundum will cross only the lower part of ostium secundum. Soon it get fused and divide our atriums into two parts. Then we will come and know about interventricular canal. From the lower part of this heart, there will be a muscular portion arises to meet septum intermedium. Then septum intermedium release muscles. This muscular portion and membranous portion meet together and divided our ventricle into two parts. Then we will know about valves. Septum intermedium will release some endocardial cell. This cell will be attached with with annulus ring and chordic. They will form tricuspid valve and left and bicuspid valve. They will help to outflow tract. Then we will know about how superior vena cava and inferior vena cava form. From the sinus venosus, it's gonna be happen. Left horn, we know about left horn and right horn. Left horn is going to degenerate and fused into one horn, into this one horn. So, and umbilical vein of the right horn will degenerate, and there will be common cardinal vein and vertinal vein of the right horn. This common cardinal and vertinal vein will move and common cardinal vein is going to be happen superior vena cava, and vertinal vein is going to be happen inferior vena cava. But where is the left horn? This left horn is going to be happen coronary sinus. Then we will know about aorta and pulmonary trunk. If we cut primitive ventricle and primitive atrium and bulbous chordiosis into sagittal section, we will got this, and they will release some neuroendocrine cell from the anterior side and posterior side, and they will meet together, and their aorta is going to rise from the bulbous chordiosis and in the posterior side of primitive atrium. Then pulmonary trunk will release from the posterior side of bulbous chordiosis and the anterior side of this intermedial septum. This is going to be happen for the heart. Thanks for giving me opportunity. Pardon my all mistakes.
Hello everyone. I want to explain clavicle from anatomy. Okay. The clavicle is the long bone because it has two ends, medial end and lateral end. Medial end are also called sternal end, and lateral end is also called acromial end. Sternal end is attached with manubrium of sternum with the help of sternoclavicular joint. An acromial end attached with acromial process of scapula with the help of acromioclavicular joint. We have two clavicle, one is right side and one is left side. Acha. It is a touchable bone in people who have less fat in this region. As we can see in the picture, it is clearly visible that the clavicle it creates a blaze in the skin. Some people also call the clavicle bone is a beauty bone or collar bone. The word clavicle it comes from a Latin word clavicula. This means little key or collar bone. The clavicle is most commonly fractured bone because when you fall in an accident or when we break something, our clavicle, it is high chances to our clavicle is fractured because it is transmit our weight shoulder to sternum. Function of clavicle support the shoulder and transmit the weight of the limb to the sternum by the muscles. The clavicle has two parts, medial part and lateral part. Medial part has three muscles and lateral part has two muscles. In anterior part of medial side, it is pectoralis major muscles. Lateral posterior side has no muscles. Its superior part has sternocleidomastoid muscles, and its inferior side it has subclavius muscles. Lateral part of clavicle it has two muscles. Superior part has trapezius muscles and inferior part has deltoid muscles. Okay. Someone or our teacher when told us to identify it is right clavicle or left clavicle, then we have to remember three things. First of all, we have to remember the end, medial end and lateral end. Medial end is quadrilateral and lateral end is flat, and the superior part is smooth and the inferior part has a groove. Okay, and the anterior part and the body of the shaft. The body of the shaft has two. It is curved, and convex curved and concave curved. Convex curved had 2/3 of medial side, and concave curved had 1/3 of the shaft. And the convex curve always sit in the anterior side. Okay. This is medial side and this is lateral side. Then this is my sternum and medial side and always sit in the sternum side, and the lateral side always in lateral side. Then it is medial side and this is lateral side, and the convex part is always on anterior side. So it is left side clavicle. It's your turn. Who can tell it is right sided clavicle or left sided clavicle? Right side. Okay, thank you.
We are going to make two types of nerve here, which will innervate in our muscle. That's our muscular nerve, and another is subcutaneous nerve. At first, we are going to make the subcutaneous nerves. There are 4 subcutaneous nerves in our cervical plexus, and 3 arises from the communicating branch of the nerve root C2 and C3. The first one is greater auricular nerve, and the second one is lesser occipital nerve. This greater auricular nerve innervates in our ear region. As we know, the word auricles means ear, and the nerve lesser occipital nerve, it will innervate in our occipital region, upper skull. And here the another nerve is cervical nerve, which will innervate in our anterior portion, that is the anterior triangle of our neck, and it will give sensation of our external impulses such as touches, heat, and like this. And the fourth on of the subcutaneous nerve arises from the connecting branch of C3 and C4, and it is the subclavicular nerve. Actually, this subclavicular nerve again divides into three parts. This is the medial one, so this is called the subclavicular nerve, and it lies intermediately, so this is called the intermediate subclavicular nerve, and this one lies laterally, so this is called the lateral subclavicular nerve. Which helps in the sensation of our external impulses such as heat, touches, and like this. And now we are going to make the muscular nerves. We use a red marker for our muscles or muscular nerves. From the nerve root C1, on nerve bridge passes to a muscle, and on nerve bridge passes and it will bifurcate into two, and it innervates into two muscles. The first one is glenohyoid, and the second one is thyrohyoid. And from the nerve root C1, C2, and C3, three nerves are coming out, and it meets a place and it makes a loop. This loop is called ansa cervicalis loop. This ansa cervicalis loop innervates into four muscles. The first one goes to the omohyoid, second one goes to sternohyoid, third one is sternothyroid, and the fourth one is omohyoid. Here we see two omohyoid. Actually, this is the superior part of omohyoid. Actually, this nerve goes to the superior part of omohyoid, and this nerve goes to the inferior part of omohyoid. And now from the nerve root C3, C4, and C5, three nerves coming out, and it makes a place and it gives innervation to a muscle. Actually, the name of this nerve is phrenic nerve, and it has two functions. It has both the sensory and motor function. It is sensory for the precordial of heart, and it is motor for the diaphragm. We know diaphragm, it is the muscle of our chest for respiration. And actually, these are the muscles in where the cervical plexus are innervation. Some cranial nerve also helps here, such as from the superior areas, the 12 cranial.
Thank you. So please, all the coming students, you will come here, you will take the mic from me, and then when you are going back, you will give it back to me. Okay? So that there are so many participants, we have to sit and listen to them. Your job is much easier than their job. Okay? So they are coming here, they are holding the microphone, they are explaining whatever they can. So please appreciate it, respect it, okay? And maintain silence. Just be silent, that's enough. Next we have Mehdi Hassan Alif, and the topic is cardiovascular system.
Assalamu alaikum everyone. I'm Mehdi Hassan Alif from second semester 4th group. My today's topic is CVS, means cardiovascular system. So what is cardiovascular system? Cardiovascular system means this system includes in blood circulator of blood, which describes the blood circulation. A cardiovascular system is a part of circulatory system. CVS includes heart and blood vessels. Now we are going to discuss about ECG. And after this we will learn how to read ECG, and inshallah after this you will all feel like a doctor, inshallah. So from this ECG we determine heart rate, heart rhythm, abnormal electrical condition, poor blood flow to heart muscle, it's called ischemia, heart attack, coronary artery disease, hypertrophy of heart chambers. That is used for recording ECG is called ECG paper. ECG paper has horizontal and vertical lines. This smallest square is 1 millimeter. Every 5 line is 50 millimeter. Is thickened. Duration. Time duration of different ECG waves is horizontal on x-axis. On x-axis, 1 millimeter is 0.04 second and 5 millimeter is 0.20 second. So here we are going to how to measure the heart rate. So next slide. Before this, I will show you in some briefly that that is from P to Q. It called the PR interval. From Q to R is called the QRS interval. QRS interval. From S to T, it is ST segment. There has a line. There passes no electron.
Mehdi, your time is over. Thank you.
Good afternoon, my dear teachers and classmates. Today my topic is enzyme. Why we need enzyme? In our human body, there are many reactions are happening. So in every reaction, almost every reaction, we need enzymes. Before knowing enzyme, we need to know catalyst. Catalyst is a chemical substrate which increase or decrease the rate of chemical reactions. So enzymes are biocatalysts produced by living cells to catalyze biochemical reactions in our body. There are two kinds of catalyst: positive catalyst or negative catalyst. Positive catalyst increases the rate of reaction, and negative catalyst decreases the rate of reaction. So enzyme is a positive catalyst. So enzymes accelerate the rate of chemical reactions, and but itself remain chemically unchanged at the end of reaction. Enzyme activity is specific for a specific substrate and a specific reactions. Substrate activity like glucokinase acts only on glucose, and same like reaction specificity. Pyruvate in our Krebs cycle, pyruvate can undergo several reactions to produce different products. But in each reaction, we need individual separate enzymes only for that reaction. Mechanism of enzyme catalysis. We need activation energy to make any reaction in our body. So enzyme decreases the what is activation energy? Activation energy is to happen any reaction. We need activation energy to accelerate. So enzyme decreases the activation energy, so the reaction can happen quicker and easily. So factors affecting enzyme activity. There are many factors like temperature, pH, and substrate concentration, enzyme concentration. So there is optimum temperature in which the enzyme works so accurately. It is 40 degrees Celsius. And if there is over than 40 degrees Celsius temperature, the enzyme will be denatured and it will not operate correctly. And there is pH affecting. There is optimum pH of 8, which increases the enzyme activity. If it is greater or lesser, it will not function correctly. So thank you very much.
Thank you. Now, silence. We are going to call the next participant. Students, please be silent. Yes. We missed one student in between. So now we have 3 students left. Okay. But the interesting thing is that in the last 3 students, one student is from Pakistan, one is from India, and one is from Bangladesh. Okay. So I'm just saying it is going to be exciting. Okay. So next. Now the next student that we have is Mamun Mia from group 3, and he will be talking about histology of cardiac system.
Good afternoon, everyone. Assalamu alaikum. My name is Mamun Mia. I am from Bangladesh. I am studying at Avicenna International Medical University, second semester, third group. My subject histology and my topic histology of cardiac system. First of all, histology means the study of the microscopic structure of tissue and cardiac system. Cardiac means heart. You know heart? I know you heart. The heart is pumping organ. Pumps blood through your body. It is made of multiple layer of the tissue. Your heart is at center of your circulatory system. Histologically, heart is mainly composed of cardiomyocytes and connective tissue. Dense connective tissue with elastic fibrous is present in the cardiac and skeletal muscles. More thing, heart is 3 wall. Heart is 3 wall. Epicardium, myocardium, and endocardium. Sometimes epicardium call it pericardium. And 3 wall, most important thing, epicardium is outer layer, and myocardium is thickest, and endocardium is innermost layer. Epicardium, outermost layer of the heart, composed of the connective tissue with nerve, vessel, adipocytes, and outer layer of the mesothelium. Mesothelium secretes pericardial fluid and cover the protect of the heart. Its main heart important thing, heart protect of epicardium. Okay, next. Cardiac valves. 4 valves and 2 AV in the chamber, 2 similar, aortic and pulmonary, composed of the connective tissue layers covered by endocardium on each side 3 layers. Esophagus, loss of collagen and fibrosia, dense crow of connective tissue, and ventricles, dense connective tissue with mainly elastic and collagen fibers. What is Purkinje fibers? Purkinje fibers impels conducting fibers, large modified muscles cell, and cluster in group together 1 to 2 nuclei and stain aptly due to fewer myofibrils. Thanks all.
Participants left, okay? So now you can all cheer up and be happy again, right? So just the last 3 students. So please be lively, please encourage them. Now we have our second last participant for today, Nashrat Mahmood from group 4.
Assalamu alaikum.
Good evening, my dear respective teacher and my dear friends. I am from Bangladesh. Now I am going to present my topic. My topic is alveoli size, perfusion, pressure of oxygen and pressure of carbon dioxide. This is the lungs and this is the alveoli. Alveoli are the structural and functional unit of the respiratory system. Basic unit of lungs is alveoli. We can divide our alveoli into three parts: apical alveoli, medial alveoli, and basal alveoli. This is alveoli. Alveoli dilate when we inhale, and alveoli contract when we exhale. Inhale means when air go inside. Exhale means when air go outside. When we inhale, when air go inside, alveoli will increase, and when air go outside, alveoli will decrease. Now we are talking about alveoli size. Because of gravity, lungs is getting down. We see in this picture, lungs is upper side, and in this picture, lungs is downside. And what will happen when lungs is getting down? The pleural space of the top will be less. If space is more, then the negative pressure will be less. If space is more, then size of alveoli will be more. Because of negative pressure, alveoli is less. For this reason, apical alveoli is small, apical alveoli is large, and basal alveoli is small. Now we will talk about perfusion. Perfusion means how much blood go into the lungs. We see in the picture, this is the lungs and this is our heart. The bottom part of the lungs is below the heart and the top part of the lungs is above the heart. For this reason, blood go more in the base and less in the apex. And there is another reason. All the apex perfusion have small blood vessel, and at the base perfusion have large blood vessel. Also for this reason, blood go more in the base and less in the apex. Now we are talking about pressure of oxygen. All the air in apical alveoli is not going to the blood because blood flow is less than air. In apical, alveoli is large but blood vessel is small. Oxygen will be accumulated in apex. For this reason, pressure of oxygen is high at the apex. And now we are talking about base. And all the air in base, basal alveoli, going to the blood because blood flow is more than air. In basal, alveoli is small and blood vessel is large. Oxygen will not accumulate in base. For this reason, pressure of oxygen is less at the base. Now I am talking about pressure of carbon dioxide. In base, alveoli is small, but blood vessel is large. Large vessel have large amount of carbon dioxide, and it will put all into the blood basal alveoli, and it will pull by carbon dioxide. Because the alveoli is small and there is less air. For this reason, pressure of carbon dioxide is high at the base. In apex, alveoli is large, but blood vessel is small. Small vessel have small amount of carbon dioxide and it will put small amount of carbon dioxide in alveoli because their alveoli is large and there is more air. For this reason, pressure of carbon dioxide is less in air. Thanks all for your attendance and your valuable.
Thank you. Okay, so I hope the teachers have given the marks according to your wishes. And now while we are calculating the marks, I would request our respected Vice Dean, Mrs. Medina, to please tell us what she felt about this program and encourage our students.
Good evening, guys. I see second semester students. I think everyone the first time in this lecture hall. At first, I want to tell about your behavior, guys. Do you know it? Like, some manners must be there, yes. You are audience here, students are speaking, yes, they are presenting. So you need to, how to say, behave according to the manners. So regarding the students who were giving speech, want to tell some things like, I was watching your presentations and there are mistakes. Okay, as a language teacher, I am like paying attention for all these type of things. Yes, you just imagine you are going to another university with your this presentation, and how to say, you are representing your university. Yes, I can understand today it was like inside of the university, and these all people are how to say, our students. Yes, but if you will go to another university and there is like other students, other teachers, others are seeing all your presentations, and they are paying attention for all these things. Okay, so I know you are second semester students and this is your beginning only. Yes, so I wish you like more success, and you need to develop more. Best wishes for you. This is your beginning, you need to grow more. So we will see after 2-3 years that there will be like more. This was your beginning, and I like it. So thank you for all participants.
Thank you, ma'am. Now, I'm going to make our teachers a little bit uncomfortable. So you saw all our young students, they tried to teach some topics, right? And you, obviously, you are the stars of this university. You, the students love you. So now I would request you to please come, each of you, and give 2 or 3 tips on how to teach better, how to teach more effectively. What the improvements you think the students can make in their presentation. I would request one by one all of you to please come. We'll begin with Abdurrahman sir.
Good afternoon, everyone. So, firstly, okay, please just give me 1 or 2 minutes. It won't take long. So, firstly, I want to thank Sir Sam, especially inviting me over here. So, it was a great initiative of Sir Sam. Like, I could not think of this idea. Like, I should engage like first year students like in this type of activities. So, the all credit goes to Sir Sam. So please give us. And being a teacher, as today you are trying to be teacher also. So the requirement of this competition was the main theme was the time. Like you have to explain your topic between 5 to 7 minutes. So I would suggest that next time when you will prepare any presentation or whenever you have any chance in future, so try to pay attention to your time management. Okay, so just prepare topic according to the time limit, and if you know something, you have to be confident enough so that you can present yourself in not in front of us. Any audience can be any. They can be audience from other universities. So you have to stay motivated and try to be confident, and hope in future you will do better. Thank you very much. Now I would like to invite Sir Vivek, please, on stage.
Good evening, everyone. So, very congratulations that we hold this today, and I got a lots of plus and negative points, of course, as a suggestion also, and for our improvements also, that what we can do. So individually, because you all are my students, I can observe each and small and minute mistakes, but I can start with this one, that first of all you have to know that what topic you are going to choose, because most of you was so much confused about your topic, and it was looking like that somebody forced you, or he was interested in something like, yes, I can do. Yeah, that is great. The confidence is great, but overconfident always kills. So from next time, do one thing. And I don't want to take individual names. I don't want to make you more uncomfortable. But from next time, whenever you like another semester, or maybe just first of all see that where you're going to give presentation. Second thing, that you see that what subjects, what topics you completed already, how much material you can cover. Yeah, if you will collect the material from Google, then there is lots of materials. But we don't need this. Still we not completed pathology, we still we not complete even physiology, all of, yes, histology. So always be smart when you are choosing the topic. You are confident of it, then only you just perform it, okay? And again I will come on the first, that guys, if our vice dean is saying and repeating this thing about your behavior, about your, like how you sounding, so it's really very bad. As a teacher, I am feeling very bad. So please, I am requesting for the very last time that please don't do this. We all are here, of course. Maybe some of feeling uncomfortable. Okay, first of all. Okay, so the remaining thing I will talk to you all in lecture. So thanks a lot, and a very very congratulations. Wish you all the very best. You tried really very hard. Okay, so next could be our favorite Dr. Bauer.
First of all, I would like to pay special thanks to Dr. Assam and the whole crew, and especially for me, all participants are the winner. I think it's a very huge thing for the younger students to be coming to face the whole audience. So grow with the positive thinking, improve your behavior. Best of luck. Thank you so much, sir.
In front of such a huge audience and presented their topics, but the only point I want to pinpoint is that grab the concept of the gathering. It was can teach everybody, I think. Anybody can teach. Here it was not for the presentation. You have to teach a concept. So see the audience, level of their knowledge, and deliver the lecture or anything you are delivering. Because I think I haven't studied anatomy and physiology. It was like
especially the participants, and you are waiting eagerly for the announcement of the winners. But before we announce the winners, like I promised you, all of you are going to get certificates of participation. So first we will start with the participants, okay? So if you are getting certificate of participation, it means you did not get the first, second or third prize, unfortunately. Okay, so first we will distribute the participant certificates, then the third prize, then the second prize, and in the last we will give the first prize. Okay, all right. So rewarding you guys for your efforts, right? So sir, will please I will first of all I will invite our vice dean, Mrs. Medina, to please come and distribute the certificates. So the first certificate of participation is to Mohammad Mehdi Hassan. Please give a huge round of applause. The next certificate of participation is Tarun Pal Singh. You can take some nice pictures for Facebook, yes? Okay, thank you. The next, please give a huge round of applause. Congratulations. Next student, Al Batul. Congratulations. Next, Nishu Gurjar, please. Huge round of Thank you. Next student, Mamoon Mia. Please students, you have to show your energy. Where is your energy? Next student, Rizwan Ali Solangi. Thank you. Next. Thank you. Next certificate goes to Mehdi Hassan Ali. Clap for your friend. Thank you. And the last certificate of participation is for Abdullah.
We are, of course, we are going to end it, but just hold your nerves. I'm announcing in behalf of all these respective members that soon we are going to organize a historical debate. Yes, so group-wise debate we will manage.
The top three winners will be in the front. The winners, first, second and third position. I am requesting the teachers also to please join us. Okay. Where is the first, second, third position? Okay, please come this way. Yes. And you can all, yes, just move this way.